Hello, I'm Alex and I'm a senior lecturer in medical law and also the co-director of the Centre for Social and Ethical Policy in the Department of Law at Manchester. About 30 odd years ago, Margot Brazier, who's a very well-known medical lawyer, and John Harris, who's a very well-known philosopher, and other colleagues who were here at the time, set up our master's programme in healthcare ethics and law. So within that we have a few options. It's quite flexible. If you've got a law background, so if you're a law undergraduate, for example, you can come and do an LLM, which is a programme that's really focused on healthcare law with ethics as a sort of, side show, if you like. Whereas if you're a humanities graduate, say for example you've got your first degree in philosophy, you can come and do the MA in healthcare ethics and law, where the ethics side of it is the main event with the law side of it slightly less prominent. We also have a MSc for intercalating medical students, where they reach a certain stage in their medical education and they can take a year out and come and train with us in the intercalating masters. I'd say there were two main reasons why we attract so many brilliant students at Manchester. First of all, for lawyers who want to specialise in medico-legal problems or another kind of big issue within legal practice such as mental health law, we give them a really amazing solid grounding in healthcare law. They have a choice of which optional courses to study, and they also have two compulsory courses which covers the sort of the basics of medical law and the basics of kind of philosophical bioethics to ground them in their chosen focus. The other main reason students come and study with us is because perhaps they want a career in healthcare, so they're able to study the core topics within medical law and also medical ethics. I would say the great thing about our course is we get a really interesting mix of students. So for example, some of our competitors just do LLMs and then they would tend to only attract law graduates, whereas because we have the LLM and the MA and the MSc, we have a wonderful mix of law graduates, humanities graduates and also healthcare professionals. And they all work together then to inform each other. The campus course is basically split into three parts. So in the first semester, you'll do two courses. One is medico-legal problems, where you do the core law aspects, things like autonomy and consent to treatment, health and human rights, clinical negligence, introduction to sort of reproductive law and resource allocation, whereas in the philosophical bioethics course you look at the ethical side of that debate. The big issues such as organ donation, access to treatment, and how we decide these really important philosophical questions on matters of health policy, for example, will be covered. And then the second part of the full-time course would be to choose options. So we have an array of options looking at kind of social issues in healthcare, looking at global issues and public health law or mental health law. Or on the ethics side, you can choose options such as genetics and genomics, research ethics, and methods in bioethics and healthcare law. And then the final part of the course will be focused on writing a dissertation, where you get one-to-one supervision with either a medical lawyer like me or a ethicist, depending on the topic that you've chosen. The academic skills that students develop are research skills, how to go away and if you want to be a lawyer, how to research that particular area of law, or indeed research a sort of philosophical background and the ethical issues that are informing a debate. So those research skills are really important. Some of our assessments are sort of writing a report type activity, whereas others are writing a sort of more traditional academic essay. So within both those types of exercises, your writing skills and your ability to kind of formulate an argument and logically address a topic that's quite complicated will be enhanced. In terms of employability, we get a real variation actually. So students coming with a first law degree and wanting to develop their legal knowledge will often go on to either go to the bar and become, for example, an advocate in issues like clinical negligence or mental health law, or they will go into practice as a solicitor. Clinical negligence is a big industry, and so that is obviously a good destination for somebody wanting to be a health lawyer. Besides that, I think students go on to a diverse range of destinations. We've had students doing our masters who've gone on to work for the GMC, or in health management, or in policy work as well. And then in relation to our intercalating students who are training to be doctors, they'll go on and they will complete their training, and actually doing the MSc will help them enormously. And we often hear back from alumni that they've gone on to sort of chair the ethics committee in the hospital they're working in, or they're asked to provide training for other doctors in healthcare ethics and law. I think Manchester's just, there's so much going on, so much culture. You know, the nightlife is unbelievable, and it's such a growing, vibrant city. So I think if you're the sort of student who likes city life, who likes culture, who likes, you know, clubbing and going out, then it's just brilliant. In terms of the university, medical law is a long-standing kind of specialism at Manchester. We've got an amazing interdisciplinary group of medical lawyers and ethics experts. And so together we combine our expertise to provide these postgraduate courses. I think Manchester is a great destination in which to sort of train to be a medical lawyer. We've got some of the leading law firms practicing in this area in the city. We've also got the GMC in Manchester. They established their base here a few years ago. We've got, you know, the big training hospital on our doorstep, and many other healthcare providers. So it's a real sort of centre for healthcare ethics and law.